I recognize the gentleman from Virginia, Mr. Griffith, for 5 minutes for questions.
Thank you, Mr. Chairman. I've heard numerous people here today say that this probably shouldn't have a big impact on jobs. I've even heard some folks say they thought when they heard the title of the hearing was Health Care Act and Jobs, they thought it was going to be, something positive. I'm here to tell you that's just not the case. I'm proud to represent the Commonwealth of Virginia. I served in the General Assembly there for 17 years. Virginia, which would be closer to a big business than a smaller business, has made the decision. Both the House and the Senate, at the request of the governor, have limited part-time hours for state employees. Now, it still sits on the governor's desk and has not yet been signed into law, but since he requested it, I doubt he's going to amend it out. And so we are facing a situation where 7,000 workers in Virginia are going to find that their hours are being cut. A friend of a friend, it has been reported to me that a friend of a friend is now looking for new work. She had been working for the Department of Health, but with the cutback in the hours, she's got to find something else in order to take care of her family. These are the real impacts. This is the real impact on jobs, and it's just not the Commonwealth of Virginia alone, and I don't know about other states, but in my district, the town of Wytheville, now it's not a big town, and I'm sure it's not nearly the 7,000 people who are affected statewide, but the town of Wytheville is also considering cutting back on their part-time hours. And in an editorial, and I think they've said it very, very well, in an editorial that ran on the tricities.com site, which usually means it's either the Wythe paper or more likely the Bristol Herald Courier, they said that consider these cuts, in referencing the fact that the town of Wytheville and Councilman Hunley said it would be cost prohibitive to provide all the town's part-time employees with health insurance, so they're cutting their hours back. And then they referenced the Commonwealth of Virginia, and they said, consider that these cuts are coming from entities with no profit motive, no corporate board demanding right-sizing, no shareholders screaming for costs to be held down, and no customers who can take their business elsewhere. Then ask yourself what the average business, which does not face those extra demands, is going to do. Well, I will tell you that what I hear from numerous small and medium-sized businesses, what they're going to do is that they're also going to cut the hours of their part-time workers. And in some cases, and I'll ask you this, Mr. Boucher, I know you haven't done it, but if you are not hearing from lots of your colleagues that they are in fact shutting down stores in advance, knowing that if they have a store, now it's not all the PPACA or Obamacare, but as one of the restaurant chains in my area's CEO told me, he said, we're not going to shut all our stores down. It's going to make life harder. But in those stores that are marginal stores, we're going to shut down. And I don't know if that was the only factor, but I did notice about 6 months ago an announcement that one of his stores in an area that's probably a marginal area had in fact shut down. Are you already seeing in the industry, I know you didn't do it, but are you seeing in the industry that folks are eliminating those stores that may be in the black but are just barely in the black, and the cost of this additional cost to them with their part-time employees will hurt, and therefore they're just going ahead and making the decision to shutter the doors?
You know, I can't speculate on what other restaurateurs are doing, but I will tell you that there are different business models for different levels of dining. You know, fine dining has different business model than fast food, than casual. And, you know, as I stated earlier to the gentleman, that, you know, our end of the day is 4 cents of every dollar. If there are restaurants that are 1 cent on every dollar, this puts this.
So you can see under certain business models, because I have limited time, but you can see under certain business models that this might very well affect those entry-level workers and the folks working in the restaurant industry. Am I correct? Yes.
There will be restaurants that are right on that tipping edge that could be pushed over.
And let me say this. In Virginia, the vast majority, although I referenced somebody at the Department of Health, the vast majority of these employees actually work in our 23 two-year community college systems. And one of those community colleges spokesmen was quoted as saying that one of the big detriments that they have from the state taking this action as a result of PPACA, that they are going to lose an asset. And I quote Josh Meyer, spokesman for Virginia Western Community College. One of the great advantages of community colleges like Virginia Western is that we can agilely adapt the training and educational needs of the region. Our adjunct faculty gives us the flexibility to create new courses as the need arises. This new policy will limit the hours that such faculty can teach. He wrote that in an email to the newspaper. And obviously, if you need to gear up for some new area and you don't have the personnel to do it, you're actually going to impact the ability to retrain folks who need jobs. Am I correct?
That is correct.
I thank you and yield back my time, Mr. Chairman.
Chair, thanks, gentlemen. That concludes our first round's